Hip examination by Professor Hatem Galal Saeed. Examination can be divided into inspection, palpation, range of motion, and special tests. However, when we're looking for femoroacetabular impingement, we can do certain tests in a specific way to include both special test and palpation and inspection at the same time. We're actually going to follow the examination in a position manner. So we'll start with the supine position, followed by the side, followed by the prone position, and then the seated position, and finally the standing position. One of the first things to look at is the position of the foot. If this patient has femoroacetabular impingement on the right side, his right foot will be less external rotated compared to the normal side. The leg roll test is used to test external and internal rotation of the hip in full extension. For range of motion, we flex the hip all the way to get maximum flexion. Normal range is up to 135 degrees. Patient will get also pain in this position in cases of subspinous impingement. Then we go to 90 degrees. We test for external rotation. The normal range is within 50 to 70 degrees of external rotation, and then internal rotation with a normal range of about 30 degrees. The impingement test is performed 90 degrees of flexion. We do adduction of the hip, then we do internal rotation. So it's flexion, adduction, internal rotation of the hip, which causes increased pain than just doing internal rotation. The Faber test is used to test for flexion, abduction, external rotation of the hip. We measure the distance between the knee and the table and compare to the other side. In cases of hip pathology, such as in femoroacetabular impingement, we'll find that the pathological side, there is increased distance between the table and the knee, thus showing that there is limitation of external rotation of the hip. This will differentiate between a hip pathology and an extra-articular pathology. We also test for the labral stress test. We do deep flexion of the hip to try to squeeze the neck of the femur on the labrum to elicit pain in cases of labral tear. Then we do abduction, external rotation, which is painful in cases of posterolateral impingement. The resisted straight leg raise test is used to detect intra-articular pathology compared to extra-articular. The patient tries to maintain his leg while the examiner pushes the leg downwards. This puts load on the hip and causes pain. The Thomas test is performed to test for flexion deformity of the hip. If we're testing the left hip, we get the patient to hold his right knee all the way to the chest. This eliminates lumbar lordosis and pelvic tilt, and then we can see how much flexion deformity of the other side is present. In palpation, we examine local tenderness on the trochanteric area for trochanteric bursitis, which is common with femoroacetabular impingement and hip pathologies. Also, we examine the sacroiliac joints on both sides and the lower back. The Ober test is used to test for iliotibial band tightness, flexion of the knee, the hip is done straight, and we try to do adduction of the hip. The Ellis test is used to test for rectus femoris tightness. When we try to flex the hip in a prone position, you'll find that the pelvis raises up away from the table. This tells us there is anterior tightness of the rectus femoris. The Iliopsoas test is performed in the seated position, and the patient tries to lift his hip up while resistance is done by the examiner. This will elicit pain at the hip area. Trendelenburg test is performed to test for abductor weakness, which is common with hip pathologies. To test the right hip, the examiner puts his both thumbs on the posterior superior iliac spine, then he asks the patient to raise the other leg. In a normal sequence, the elevated side posterior superior iliac spine will be raised upwards. If the abductors are weak, the posterior superior iliac spine will actually drop to that side. Can be seen here for the right side, which indicates left hip abductor weakness. The single leg stance test is used to test for stability of the hip muscles, lower limb and core muscles together. It's really an indication of weakness of the whole area, or if the patient has achieved proper stability control. In this example, we can see he's got more weakness on the right side than on the left side.